Pregnancy is a wild ride, especially in the first trimester. Did you know that during these early weeks, your body pumps 50% more blood to support your baby? Or that your little one's heart starts beating as early as 22 days after conception? These incredible changes often happen before you even realize you're pregnant. But here's the thing, many moms-to-be constantly worry about whether everything is going well. The truth is, your body gives you plenty of signs, some big, some small, that things are progressing just fine. You just need to know where to look. In this video, we're diving into 6 surprising signs that your pregnancy is on track during the first trimester. From the strange science behind cravings to why morning sickness might actually be a good thing, we'll cover it all. Stick around because these insights could save you a lot of worry, and help you enjoy this amazing journey. Chapter 1. The Power of the Glow. What your skin says about baby's health. You've probably heard about the pregnancy glow. It's more than just a saying, it's biology working its magic. During pregnancy, your blood volume increases by about 50%, according to the American Pregnancy Association. This extra blood flow, paired with hormonal changes, makes your skin appear brighter and more radiant. But what if you don't see this glow? Don't stress. Not all moms-to-be notice it right away, or at all. For many, glowing skin shows up later in pregnancy when hormones settle. As dermatologist Dr. Ava Shambin explains in Skin Deep, hormones like estrogen and progesterone are key to maintaining a healthy pregnancy, and they're often responsible for subtle skin changes that indicate things are on track. Here's a tip. Keep your skin moisturized and use sunscreen daily. Hormonal shifts can make you prone to melasma, aka the mask of pregnancy, which causes dark spots. Sunscreen helps keep your glow, glowing. Chapter 2. The Appetite Awakens. Cravings that signal good growth. If you suddenly crave pickles and ice cream, or can't get enough orange juice, you're not alone. About 50–90% of pregnant women report cravings, according to a study published in Frontiers in Psychology. Cravings often indicate your body is working overtime to meet your baby's nutritional needs. For instance, craving citrus fruits could mean your body needs more vitamin C, which helps develop your baby's bones and teeth. Similarly, a hankering for dairy might signal a demand for calcium. On the flip side, food aversions can also be a sign your pregnancy is on track. Your heightened sense of smell, driven by increased levels of the hormone HCG, often triggers these aversions as a protective mechanism. Pro tip. Listen to your body, but aim for balance. Cravings are your body's way of communicating, but you don't have to indulge every whim, says nutritionist Lily Nichols in her book Real Food for Pregnancy. Focus on whole, nutrient-dense foods while treating yourself occasionally. Chapter 3. Energy Shifts. Why fatigue means your body's on track. Feeling utterly exhausted? It's a good sign. In the first trimester, your body is building a placenta, a temporary organ that provides nutrients and oxygen to your baby. This process takes a tremendous amount of energy. According to the American College of Obstetricians and Gynecologists, this fatigue is your body's way of telling you to slow down and prioritize rest. One lesser-known fact is that your basal metabolic rate, BMR, the energy your body uses at rest, can increase by 20–30% during pregnancy. No wonder you're tired. But it's not just physical work that's wearing you out. Hormones like progesterone, known for its calming effect, add to your sleepiness. What can you do? Power naps are your best friend. Aim for 20–30 minutes during the day to recharge. Also, stay hydrated and eat iron-rich foods like spinach and lentils to combat pregnancy-related anemia, a common cause of extreme fatigue. As midwife Ina May Gaskin says in Ina May's Guide to Childbirth, listening to your body during pregnancy is a form of self-respect. Rest when you need to, and trust that fatigue is often a reassuring sign that everything is progressing well. Don't forget to subscribe for more tips and insights. Stay tuned as we dive into even more surprising signs your pregnancy is going smoothly. Chapter 4. Morning Sickness 101. Why it's, weirdly, a good thing. It might sound odd, but feeling queasy is often a positive sign of a healthy pregnancy. About 70–80% of pregnant women experience morning sickness, according to the American College of Obstetricians and Gynecologists, ACOG. This nausea is linked to high levels of human chorionic gonadotropin, HCG, a hormone critical to maintaining your pregnancy during the first trimester. A fascinating study published in JAMA Internal Medicine even found that women who experience nausea and vomiting have a slightly lower risk of miscarriage. Morning sickness is an evolutionary adaptation, says Dr. Margie Profet, a scientist known for her research on pregnancy. It helps women avoid foods that might harm the baby during its most vulnerable stages of development. If morning sickness is interfering with your day, try these strategies. 1. Eat small, frequent meals to keep your blood sugar stable. 2. Carry ginger candies or sip ginger tea. It's scientifically proven to reduce nausea. 3. Avoid strong smells and spicy foods, as they can be triggers. If you're lucky enough to skip morning sickness, don't worry. Many women have healthy pregnancies without it. Every body is different. Chapter 5. Heartbeat Symphony. Signs your little drummer is thriving. One of the most exciting moments of the first trimester is hearing your baby's heartbeat for the first time. This usually happens around 6–8 weeks during an ultrasound. The heart starts beating at about 100,120 beats per minute, BPM, and can increase to 170 BPM by week 9, says the American Pregnancy Association. A strong, steady heartbeat is one of the most reliable signs of a healthy pregnancy. In fact, studies suggest that pregnancies with detected heartbeats after 6 weeks have a 90–98% chance of continuing successfully. It's nature's way of saying, we're on track. If you're eager to stay connected between appointments, home fetal Dopplers are an option, but use them sparingly. As Dr. Rebecca Levy-Gant explains in your Pregnancy and Childbirth Handbook, relying too much on devices can cause unnecessary stress. Trust the professionals monitoring your baby's progress. Pro tip: focus on hydration and nutrition. A healthy diet helps support your baby's development, including that powerful little heart. Foods rich in folate, like leafy greens and fortified cereals, are especially helpful in reducing risks during early pregnancy. Chapter 6. Body Talks. Small pains that pack a positive punch. Mild aches, breast tenderness, and even occasional cramping are common signs that your body is adjusting to its new role. Think of it as your body stretching and growing to make room for the little one. Dr. Jennifer Lang, in her book The Whole 9 Months, explains it well. Your uterus is like a balloon expanding ever so slightly in the first trimester. It's a gentle, natural process. Breast changes are also a good indicator of rising pregnancy hormones. Many women notice soreness, tingling, or even darkening of the areolas. This is your body preparing to nourish your baby when the time comes. It's important to differentiate normal discomfort from concerning symptoms. Mild cramping without bleeding is usually nothing to worry about. But if you're unsure, always consult your doctor. Trusting your instincts is never a bad idea during pregnancy, says Dr. Lang. To ease common discomforts. 1. Use a warm compress for lower back pain or mild cramps. 2. Switch to a supportive bra to relieve breast tenderness. 3. Stay hydrated. Dehydration can sometimes intensify mild cramping. Remember, these changes mean your body is working exactly as it should. Small pains often signal big progress. Thanks for watching. Don't forget to subscribe for more expert insights and tips on how to navigate every stage of pregnancy.